Hey guys, Dr. Victoria Munoz here, and as many of you may know, we are currently doing a series on regenerative therapies. And last week, or actually the week before last, I missed a week, so sorry about that. We talked about prolotherapy and its benefits, and today we're going to talk about PRP. Now, PRP is like the next step up from prolotherapy. Prolotherapy has tendency to do repair of like fraying and minor tears in the soft tissue. It also helps to tighten ligaments when you have instability of a joint. It works beautifully, but hey, there might be a need for something a little bit more powerful, and that's where PRP comes in. So let's talk about PRP and exactly what it is and what it does. So PRP stands for Platelet Rich Plasma, and it's a therapy that is actually an exciting branch of medicine. It allows athletes and the average person to heal and recover from chronic pain and injuries of the tendons, muscles, ligaments, cartilage, nerves, bone, and more. So the treatment is safe, it's non-surgical, and it doesn't even use drugs. So with PRP injections, the patient's own blood is used. We draw the blood and we use the platelets from the blood, which is the healing agent. So, we commonly know platelets as something that clots. It's a clotting factor. But what we've learned so much more as we've researched it and used it in medicine. So the idea behind PRP therapy is relatively simple on the surface, but a working knowledge of your body's natural ability to repair is key in understanding PRP and how it works. So everybody knows, like I said, that platelets stop bleeding. They are a clotting factor, but research now knows that these platelets do more than coagulate and stop bleeding. So they also release growth factors, which is a beautiful discovery because what the growth factors do is they attract your own adult stem cells to the area to start healing and rebuilding that soft tissue. So these cells are called progenitor cells, and they draw them to the site of injury. So the platelet-rich plasma therapy maximizes the platelet-progenitor cell relationship. During your appointment with me, we will perform a blood draw, and what I do is I draw the blood, and the blood is placed in a centrifuge that separates the platelets from the red blood cells. After about 20 minutes of spinning, we take the vials out and we draw the platelet-rich plasma off the top. So what I do is through physical exam and imaging, I could determine exactly how and where I need to inject for the best possible result. So the high concentration of platelets is loaded with growth factors, which expedites the healing recovery process. So the entire procedure is done in office, and it takes about an hour to complete. So how often are PRP injections administered? Well, so after you receive a PRP injection, you will be asked to return for a follow-up appointment 6 to 8 weeks later. And what I will do is I will evaluate your injury to see how effective the PRP therapy has been. While most people recover fully, some patients will return for 1 or 2 more treatments, and the injections usually are spaced 8 to 12 weeks apart. So what are the benefits of PRP injections? That might be your next question. Well, platelet-rich plasma therapy offers many benefits. Athletes especially are interested in this treatment option, and it's helped them speed up recovery from workouts and to get them back in the game. It also helps the average person with joint pain, back pain, any kind of musculoskeletal injury, and get you back your quality of life. So this is a natural healing process. Your body provides absolutely everything that is needed to do its own healing. The problem is that these areas that are injured don't heal very well on their own. They need a trigger, and that's where the PRP comes in. These growth factors actually recruit the progenitor cells to the area of injury, which wouldn't happen otherwise. we don't really heal fully after the age of 10, believe it or not. Our regenerative mechanisms in our body start to dwindle pretty quickly after that, and the human body just doesn't heal like it did when we were children. So that's why these therapies are so important, to get you better. So PRP injections, they leave absolutely no scars. They're very affordable compared to the cost of open or minimal invasive surgeries. PRP therapy is very affordable. It's a very affordable alternative and very effective. So what kind of injuries can PRP treat? Well, where do I begin? The platelet rich plasma therapy can be used to treat ligament injuries, including sprains, strains, injuries of the MCL, ACL, PCL, LCL in the knee, which are all responsible for stabilizing the knee and making it functional. Tendon injuries, including rotator cuff, Achilles tendon, tendonitis of the elbow, such as golfer's elbow, tennis elbow, and patellar and quadricep tendons. Muscle injuries, including hamstrings, quadriceps, calves, biceps, triceps, cartilage injuries, including osteoarthritis, meniscal tears, labrum tears of the shoulder, for example, or the hip, and more. Stress fractures, plantar fasciitis, turf toe, shin splints, the general and general patellofemoral knee pain, which is also known as chondromalacia, and more. It also helps degenerative disc disease and any kind of problems and deformities of the spine as a result of degenerative and aging and injury. So, hey guys, the list goes on. And like I said, it helps everything from muscle, bone, tendon to cartilage, and it can even help stress fractures. So, hey guys, so that's PRP in a nutshell. And like I said, it's like one step up from Prolo. Next week, we're going to talk about stem cell, also known as allograft. This is the big guns. PRP possesses about 20 growth factors. The allograft possesses about 120 growth factors. And we're going to talk about how these treatments can also help regenerate degenerative disc in the spine and so forth. Next week, I'm going to touch a little bit more on that with all these therapies. So hey guys, that's it for PRP. If you have any questions, please contact me. I do 15-minute free consultations to answer any further questions you might need. If you need more details about any of these therapies, I'm happy to spend time talking to you about it. If you know that this is right for you and you want to schedule an appointment, my website and my phone number are in the description. This video will be uploaded to my YouTube channel, so please subscribe because you don't want to miss out on the things that are coming up. I'm not only going to be talking about joint pain and back pain, I'm also going to be talking about gut health, hormone modulation, and other things that are that are really important for healing the body and to optimize your quality of life. So hey guys, this is a wrap. I'm going to go hit the pool, and you guys have a great rest of your week. I probably will come here a little bit early this time to talk about the stem cell treatments. Since I missed last week, I don't want too much time to go in between these videos, and I want you guys to be informed. So hey, contact me, and have a great day, and I'll see you next time. Bye-bye.